But today, mental health and suicide prevention is one of my government's highest priorities. For Victorians, these last few weeks have been devastating, and the loss of freedom that comes from the first lockdown, now combined with the second one with the Victorian wave, not being able to connect with friends and loved ones, concerns about employment. All of this takes a toll. Young mums who won't be able to have access to childcare or have just gone through a long haul of homeschooling, now having to face another long haul of it. This will put incredible pressure on families, and particularly for families with children with disabilities. And it's important that we play our role to support each other. That's why I said the other day, if anyone around the country who knows a Victorian, get on the phone and encourage them and support them during this time of their need. I want to encourage people that help is available, and I want to encourage people to seek out that support through the many mechanisms that are there, and I'll come to those in a second. But this morning I'm announcing a further $5 million to support Headspace, $2 million to support Kids Helpline, $2.5 million to support Lifeline, and $2.5 million to support Beyond Blue. Specifically in Headspace, that is to increase outreach services to young people in the community who are in severe distress. This will particularly focus on Year 11 and Year 12 students, young people who have lost their jobs, and tertiary students. The funding will be used to recruit and to train additional outreach workers who will connect with young people in the community under supervision of the experienced Headspace staff. For those young people who are already connected to Headspace, the services have been there to support them, but there are many more who are seeking that. And the advice I have had is we need to build that capability to support more and more young people as they go through this time of stress. For Beyond Blue, that funding is to expand capacity, extend counsellor web chat hours to operate 24/7 and boost the ability to refer people with severe and complex needs for 5 additional sessions. At Lifeline, the money will be used to deal with increased call volumes from Victoria, and for Kids Helpline, $2 million for Kids Helpline to increase their call answer rate and service responsibilities, and to deal with additional demand for services and links to further support. If more is needed to be done, more will be done. And the report that will come back to me, I'm expecting tomorrow from Christine Morgan, and the Deputy CMO will, I anticipate, identify further areas for us to do further work. Now, tomorrow, the 10 additional individual psychological therapy sessions for Victorians that will commence tomorrow. That's under Medicare for people in areas impacted by the second wave of the COVID-19 pandemic who have used their 10 sessions already in a calendar year, and this applies to all in Victoria. Telehealth has been an important mechanism for health services delivery throughout the pandemic, not just in Victoria, but all around the country. And indeed, for mental health, as Christine Morgan has said from this very platform here before you, we've got about half of those mental health counselling services, and the last data I saw a little while back was actually now being delivered through telehealth. So the overall total number of support services provided under those telehealth arrangements means that we were meeting the same level of service provision prior to the pandemic, and telehealth has been very important. So if you need help, your GP is the best place to start. Telehealth is available to you there, and so you can have an appointment from home via telephone or video. Your GP can provide Medicare subsidised mental health services or can refer you to other Medicare supported services provided by psychologists, psychiatrists or other eligible allied health workers. So from tomorrow in Victoria, I've mentioned those additional Medicare subsidised therapy sessions. On the web, Beyond Blue's Coronavirus Wellbeing Support Line, which was originally established through the $10 million funding in our first mental health package, is available at coronavirus.beyondblue.org.au. And that service is available in 63 languages other than English. Head to Health is another site. Headtohealth.gov.au is a central repository of useful tools and resources for maintaining wellbeing and accessing a range of evidence-based free or low-cost mental health services. Young people can log on to Headspace at headspace.org.au. And in addition to mental health support, including through eHealthSpace, Headspace has a digital work and study service which we supported through the $6.8 million of investment we made in our first mental health package. If you are a health worker, There is a dedicated tailor-made mental health and wellbeing program for frontline health workers led by the Black Dog Institute, and we have provided $3 million to establish this earlier on, and that's available through the Apple Store and the Google Play Store and is online at the blackdoginstitute.org.au. The Beyond Blue on telephone coronavirus wellbeing support line is available to you at 1800 512 348. Anyone experiencing distress can seek immediate advice support through Lifeline on 131114 and Kids Helpline 1800 55 1800. These organisations are receiving additional support. And lastly, if you're concerned about suicide, living with someone who is considering suicide or bereaved by suicide, the Suicide Callback Service is available at 1300 659 467 or www.suicidecallbackservices.org.au. Now, they are sensitive issues for us to discuss in the middle of this pandemic, but important. If you need help, reach out. Help is there, support is there, additional support is being provided. If you're aware of someone who may need help, talk to them about that. Show them the app if you're in a position to do so. Tell them about it. Tell them about these numbers. Australians, we've got to talk about these issues openly in the middle of this pandemic crisis, and I encourage all Australians to have those open conversations. Be clear if you're feeling vulnerable. Let people know we're all there to help. They're there to help you also. I also can confirm that families will be able to use their NDIS plans flexibly to support access workers in their homes, particularly in instances where children with a disability can no longer attend education or other day programs. Families should discuss their needs with their provider or contact the NDIA to seek assistance. What this means is that if a family normally had a child attend a day program or special school and those facilities are not open, the family can use their existing plans flexibly to get disability support workers into their home to assist. Disability support workers are considered essential workers in Victoria.